my name is Andrew Kohlmeyer. I'm a medical massage therapist out of Eureka, California, and I would like to talk about dementia and how to prevent it. Yeah, I'm actually talking about preventing it. There is a really big issue that happens in a lot of people. They have a hereditary aspect that sets them up to predispose them to dementia. So what happens is you have two cells in your body. You have osteoclasts and osteoblasts. The osteoclasts take it out of the bone, and the osteoblasts put it back in the bone. So what happens is people from birth have this situation where they don't have enough osteoblasts compared to osteoclasts. The ratio's off. I don't know why, but it's very, very common. I see it in a lot of people. And what happens is they mineralize in certain areas of the body. Certain areas of the body they get trapped with higher cortisol. So like areas around the sacrum, you'll have a lot of swelling. It'll raise the cortisol into that tissue, into that local area, and you'll mineralize. Where I see it, where it's a huge problem, is the trapezius border here. So the muscle border of trapezius. So that goes down to the 12th vertebrae. And what happens is the bottom of trapezius gets adhered to all the muscles underneath, the spinal erectors and whatnot underneath. And this forms a huge area of high cortisol. So what happens is that high cortisol will block the genesis, the production of osteoblasts to put that mineralization back in the bone. So basically, these people are screwed, like totally screwed. Like you get a lot of mineralization underneath the trapezius. It creeps up right, it's right on the border. Like you'll literally feel like their spinal erectors are starting to mineralize. Muscles in the shoulders are holding tension because of inflammation. That's an electrical fault. They're too electrified. It's like you're being tased, so you're just like holding tension. That's not good. So you're going to further raise that cortisol level, and it just goes on upward from there. You know what I'm getting at. It's going to go up into the brain tissue and mineralize it. Your brain isn't some magical unicorn meat that isn't going to become mineralized. That's just ridiculous. So 30 years of this high cortisol region here, this island of high cortisol, is going to, in certain individuals, they're more predisposed because they're out to begin with between that ratio of osteoclast to osteoblast. So it's just that simple in these people. Like you have to, for me, what I do is I clean up the border here, and that regains drainage into something called the thoracic ducts. So all of the legs drain into the cisterna ocelli, which is continuous with the thoracic ducts. So that's on the front side of your spine. So basically your spine is a drain into the heart. All of this tissue has to drain into there. If it doesn't, you're going to raise your lymphatic pressure there. That lymphatic pressure raise is going to cause a cortisol raise, increase in cortisol and adrenaline too. So you're not only going to have that issue, you're also going to be anxious. Very, very common. I have a lot of clients that come in, they're severely anxious. They're in a lot of pain. It's not a good situation. And then later in life, depending on how far they're out with that 50-50 ratio of osteoclasts to osteoblasts, determines how fast that progression comes in. People that are out quite a fair distance, it happens quick. So what I do is I restore the border here. That increases the drainage into the spine. Every vertebrae has to drain into that thoracic duct. You lose 3 in a row, that corresponding section fills in with pressure, lymphatic pressure. So you don't want that. You want to get their pressure down. It's going to decrease their cortisol. They're not going to mineralize as much because they have osteoblasts there to put that back into the bone. Your bone is constantly being taken out and put back in. That's how you adapt to your environment. You want to be a pogo stick champion? You have to develop the bones to handle that, or you're just going to, stress fracture your bones. You know, that's not going to work out. So that's just the ingenious method that your body does to, you know, keep your bones strong and stronger to handle whatever we're throwing at our skeleton. So yeah, and there's also a very good supplement you can take. I know supplement, oh, you know, just take the magic pill, but what this supplement is a diuretic basically. It's called ashwagandha, and yeah, right, ashwagandha. So that lowers the affinity for your gut to drain into that thoracic duct. So you get better internally, which is great because this is often a wreck, a total wreck here. It's really hard to sometimes get this pressure down in people, and that's the cheat. So you can drain your gut into the thoracic ducts, and your internal pressure drops, which is going to bring everything in the body down in pressure, and which is utterly fantastic. It's a blessing for me as a therapist because it's so hard to deal with restoring flow into these major vessels. You know, so the legs drain into the cisterna naturalis. So, you know, you have to drain the whole body to make this knock it off. Like, you know, you have to get this pressure out. Like, it's job one is to save these people from more mineralization, more trouble. Cortisol is like the policeman of the body. Like, you need the right amount. You don't need too much, you don't want too little. You have problems either way. You know, you want it right in the middle where it's supposed to be. That's why you never really see like juvenile forms of certain things, because that cortisol raises up or lowers down later in life because of disasters like this, and you get into a lot of trouble. You know, so it's nice to keep it steady, even, on target. You're living your life. You're not getting brain trauma, destruction of cells. You know, it's not good. And I've caught this because I work in such a way where I don't use lotions. I'm not a Swedish massage therapist. I'm not like, it's not all lovey-dovey work. I'm digging out stuff. I'm working with people who have been hit by cars or fallen off buildings or attacked by whatever, you know. So I am, you know, digging in there. So for me, it's like I got more of an education into the 3D shape of structure and all that. So it's like I was able to catch these trends because I am not, my clients are typically clothed. I don't do like the Swedish kind of massage. So that has helped me to help others, because I realize, you know, what is internally all in there, you know, and like, you know, quite a big difference between just gliding over it and digging into it. You know, mainly because I really realize that there's a lot of soft tissue mineralization in places, and then you catch the outward trends of like, why is this person so bad? And then you're just like, you know, you try to figure that out, you know, and that's basically what goes on. And this is not just dementia. This is osteopenia. It's the same mechanism. Osteopenia, osteoarthritis. You know, the CDC just came out with something with how kids are dealing with arthritis. Well, no kidding. They can't go outside because it's like either blazing hot, it's like 155 degrees out, or, you know, everyone's like, you know, it's not a safe world out there. You know, it's like, when I was growing up, it was easy. You could go out, no one was messing with you, no worries. Parents, you know, 70s kid, you just let go. You know, it was easy. And that's not the case anymore. The kids can't play in groups because they get in trouble. Hey, you're all you kids, you know, what are you, causing a riot? You know, we're not used to seeing all these kids together anymore. You know, it used to be like 20 of us in roving packs, you know. No one cared. Nobody cared. But that's not the case anymore. So kids they're in the house. They're not moving around. So that's the same thing that happens to adults. You know, they're not moving around. They're at some office job. Things aren't great, and then that sets them up for this kind of stuff. I wish I could make this, you know, more common knowledge, or I don't know, like try to get this word out. So hopefully this video, I swear to God, everybody's got a stupid video about everything, so it's hard to pick and choose what is like fact, fiction, or craziness, you know, but this is my attempt to help humanity. I don't know, right? Okay, thank you.